Welcome to Yoga Framework. My name is Jeffrey, and in this video, we're going to explain PAILS and RAILS for external hip rotation. Let's begin seated in the 90-90 position, which basically means each knee is at a 90-degree angle. Your front shin is parallel to your back thigh, and your front thigh should be parallel to your back shin. We're going to be in this position for 2 minutes. And the reason we're going to be in this position for 2 minutes is because that's how long it takes for your body to realize it's in a stretch. This is a passive stretch. So I'm already feeling something. I'm not even going to try, right? That's the idea of being passive. I'm not active. So while I might hip hinge a little bit, right, because I'm working the front leg, even though if you feel something in the back leg, that's okay. But we're working the front leg. This is the external hip rotation, and I might hip hinge a little bit. I'm going to bow the stretch, which means I'm going to try to create an extension in the spine. And then I'm going to use that against that hip flexion. And that's going to help me to find the end range. I should feel this in what we would call the IT band area. I don't want to feel any tension pulling my knee. I don't want to feel anything in my back. Again, we're just trying to feel it out. It's been about a minute. And maybe you feel your body slightly adjusting. You basically cannot force a stretch. That's the idea. So the PAIL is a progressive angular isometric load, and the RAIL is a regressive angular isometric load. And what that means is you're working with the progressive and the regressive tissue. Right now, the progressive tissue is going to be the pushing down into the floor. So at this point, we're still in the passive stretch. I'm feeling it open up more. And we're not going to do anything yet. I just wanted to explain what that was because we're about to start in, let's say, 20, 30 seconds. But you should feel something happening. I'm barely doing this, and I definitely feel a change in the tissue. So you're going to get a good position here where you feel you're comfortable. If you need blocks under your hands to raise you up, that's fine as well. There are many different ways to do this position, right? You don't have to do it in this 90-90. If you needed a variation, you could always leave something in the comments or write to me personally and we'll figure it out. But this is kind of the standard of what people are using right now. So the PAILS contraction, progressive angular isometric loading. We're already in this angle. We're going to progressively load the isometric. So an isometric is me pushing into the floor. Right, I have the end range where I felt comfortable. I'm pushing into the ground as if there was a scale underneath my leg and I'm making it heavier. You're going to do this for 7 to 15, maybe 20 seconds. You're going to keep it steady, pushing down, ramping it up. I'm basically in external hip rotation and now I'm activating. And then I'm gonna rails contraction. I'm gonna pull myself together. So while I'm in external hip rotation, I'm trying to close the hip, flex the hip. I'm not leaning here, right? I'm just trying to close. Like I could lift my hands technically, not that you'd have to, but the rails contraction is closing the angle of the joint. I'm doing it the same thing, like 7 to 15, 20 seconds, and then I'm going to stop and relax there. Then we're going to do a PAILS contraction. We're going to push into the floor. All right, I'm not changing the angle here either, right? So I'm still externally rotated in the hip. I'm still at the end range. Now I'm pushing into the floor again. evenly from the knee to the ankle, driving it down, and then rails contraction. I'm going to close the joint. All right, I'm not using any power of leaning. I'm just trying to clamp, close the hip. Right? If it takes me further, that's okay. But I'm not forcing it. I'm not leaning. I don't want this creeping up into my back or my knee. And then I'm going to relax here. So right now you should be feeling it. You probably want to come out of the position. And that's the idea. You don't want to come out of the position. Time under tension. Last one, when you're ready, PAILS contraction. Notice I'm not changing the angle. When I created the rails contraction and pulled myself down, I stayed there. And I began the PAILS contraction at that new spot. 5 seconds, keep pushing down. 4, 3, 2, 1, and then rails contraction. I'm going to close the hip, an external rotation. Keep closing it, right? As if I could even lift the leg towards my face. And then I'm going to stay here, right? I'm going to hang out in this last position that I've achieved, the furthest range that I've gotten. And this is where you're getting that lasting biological change because you're waiting, right? You worked for this, kind of like this response of being active. And now you're letting the body experience it a little bit more. We're going to slowly come back out of this. And then we're going to switch sides. So we're going to come back into a 90-90 position on the other side. And it's going to feel different because you've already done this leg, and now that's the internally rotated leg. So be mindful that you might feel something different. That's okay. This is the passive stretch. Let me start the timer. So 2 minutes. That's a minimum, by the way, I would do for this. And we're just trying to let the body experience this position. There are other ways that you can do this, right? You can elevate the body, use like a bench or something that would help you to take the internal rotation out of it on the back hip, something like that. But this is, you know, what people are doing. The cool kids are doing it this way. That's why we're doing it this way. And you're almost at a minute, right? I'm allowing myself to hip hinge with the bowing of the stretch. I'm just not going to overdo it. I'm not going to let that creep into my knee, and I'm not going to let it go the other way and creep into my sacrum or my low back. Think of yourself like a stretching minimalist. What is the minimalist stretch you could do? How do you create the least amount of tension in the area you're stretching? And when I was talking about the PAILS and the RAILS contraction, the PAILS contraction is the long tissue, the RAILS is the short tissue. So right now we're stretching, right, that long tissue. We're externally rotated in the hip, and we're at the end range with this hip flexion as well. And that's pretty much finding that stretch. And then the progression is be pushing down with the long tissue. The regression is going to be pulling the leg up. But instead of lifting the leg, we're going to take the body towards the floor. That's the only difference. You're not leaning though. So you're approaching the 2-minute mark. You should feel your body adjusting at this point in some way, right? We've been here for 2 minutes. We didn't fast forward it. I sat it out with you, and there's a reason for that, because I want you to experience the change in tissue. It's very subtle, but you should feel something. So now what we're going to do is we're going to add that PAILS contraction. So I'm going to the end range of where I feel comfortable after the 2 minutes. Push down. There's like a scale underneath my leg, and I am driving that into the floor. Now I'm not going to let myself lift and pull away. I'm pushing down, but I'm not reducing the position. Maybe 5 more seconds. And then the rails contraction, I'm gonna close this angle. I'm trying to lift my leg pretty much, and that's just closing the joint more. You can adjust in small ways, right? You're dynamic. Find it safely, right? Close the hip to the best of your ability without overdoing it. I just don't want you to leaning like you technically want to control it, but you don't want to go crazy. And then I'm gonna kind of relax there for a moment when I get to the range where it's like almost my edge. All right, we're resting for like 15, 20 seconds. We're gonna start this process again. I'm not gonna reduce the position. PAILS contraction. Push into the floor. Create the tension down. This whole leg is driving. I'm not reducing. Bow the stretch, right? Keep it in the proper spot. 5 seconds. And then rails contraction. Close the hip again. And see if you can pull yourself a little lower safely. Right? Never going beyond your control. If you're shaking, that's good. That's your nervous system. It's literally nervous. That's you communicating with your body. What's more yoga than that, right? Body-mind connection, and relax. Don't reduce the position. Try not to come out of it. That's part of it. Lasting biological change. Time under tension, right? All these are ways that you're kind of interpreting what the tissue needs. Last one, PAILS contraction, push into the floor, drive down. All right, 5 seconds more, keep pushing the whole leg. And then the rails contraction, pull. All right, close the joint, don't lean. Remember, you're just closing the joint like you're clamping. I'm just showing you that as a way to activate it so you know you're not leaning heavy. You would fall if you did it the other way. And relax here at this final end range. Now I'm totally having like slight muscle spasms and just dealing with it. I'm just trying to calm the nervous system. Maybe some 3D breathing. All right, then we're going to slowly start to come out of this. You can incorporate these into your normal routine, maybe 2 or 3 times a week as needed. You can also increase tension if you'd like to make them stronger, which you really should. I'm Jeffrey, this is Yoga Framework, and every week I teach you how to create a better yoga and mobility practice. Thanks for watching.